not everyone is on board. I'm joined now by Sara Nelson, president of the Association of Flight Attendants, CWA International. Sara, good to have you with us. Happy New Year to you. I know you've been critical of this decision and have called out the CEOs of the airline about this. Tell us why so many flight attendants are frustrated with this.
Well, this was done at the behest of Delta Airlines to address staffing issues rather than have them plan properly. We have negotiated incentives for those who are well and can pick up extra time at other airlines. And there's other things that can be done here rather than asking our public health officials to reduce the public health measures that are in place to keep us from extending the life of this pandemic. So we're very concerned that we know that CDC says that they're doing this based on what they think people can tolerate. Now, I think they're talking about the CEOs, or they're talking about people who don't have sick leave and are trying to provide for their families, who don't have union contracts and feel real pressure to go to work even when they're sick, which we know is not good for us. We also know that what they've said is that during that 5-day time period, it's most likely, especially those who are vaccinated, would get rid of 90% of that infectious rate. That means that we know that we're sending people who can still infect others into the workplace and into our communities. And so we're saying it's not okay for one single airline employee or any worker anywhere to die because of this policy. We need to keep things in place. They can talk with us about what makes sense. But Delta Airlines put this in place right away to encourage people to come back to work sick, either with discipline or by cutting their sick leave pay because they don't have a contract there. And that's what they're pushing, is they're pushing people to come back to work before they're better. And this is maybe a short-term fix to staffing problems, possibly, but long-term hurt as more and more people are infected and we extend the life of the pandemic.
Let's talk more about what CDC Director Rochelle Walensky said. She appeared on at least 5 television networks on Wednesday defending the agency's decision to shorten isolation time. Here's what she said on the Today Show.
What we have right now is science that looks at the decay of the virus, how much transmission is happening during that period after you've been infected. And what we know is the most transmission happens in those first 1 to 2 days before you have symptoms, and then 2 to 3 days after you have symptoms. And that's really about 85 to 90% of all the transmission that could occur. And that's really when we want to have you stay home during those first 5 days.
So that's a medical explanation there to you. Did it convince you at all that this was the right choice?
No, this is exactly what we're talking about here. She is admitting that we're sending infectious people back into the workplace and back into our communities. And other countries have rejected this. I think it's really important that we recognize that this is a worldwide pandemic. My workspace is the entire world. We have to have credibility not only in this country, but also around the world. Otherwise, we are going to lose the ability to interact and have the freedom of flight around the world and continue to have a strong economy because people will have confidence in flying here. You know, it was only after vaccines became readily available that demand returned for air travel. So we need to be pushing everyone to get vaccinated and boosted. And we need to be working on supporting the scientists who are working to make sure that we can get that to our youngest passengers as well. We need to recognize that some people cannot get this who fly on our planes out of medical necessity. They're flying for treatment, but they can't get the vaccine. So we've got to protect everyone and make decisions that are going to keep everyone safe so that everyone can be certain that when they buy an airplane ticket, they are not asking to get COVID. They're not asking to spread COVID to their families. There has been too much hurt, too many people suffering from long COVID, too many people who have had friends and family members die, and too many people who can't get the medical needs that they need because our hospital beds are full. And so I don't appreciate, I actually think that what Director Walensky said right there is affirmation of our position, that we are admitting that we're sending infectious people into the workplace, and that is not okay.
Sara, have you reached out to the administration at all about your concerns?
We have reached out. We are working with the airlines right now on their policies because throughout the pandemic, the airlines have actually put in place policies that are over and above what the federal government requires. And in most cases, airlines are working with us right now. Many of them have not put this new 5-day quarantine into place. Many of them have kept the 10 days, have kept the continued sick leave that supports that. And we're talking with them about what they were advocating for, which was only for breakthrough cases. What Director Walensky has said over and over, and Dr. Fauci as well, is that people who are vaccinated and boosted are less likely to have more of that virus stick around for a longer period beyond those 5 days. So if it's only for breakthrough cases and we have a test negative before people are coming back, that is going to give people a level of assurance. And we can assure the traveling public that we're doing everything we can to keep them safe, and they can continue to buy airplane tickets with confidence. If we don't do this now, we are going to have more people infected. This is going to extend for more months into 2022, and we're going to have a longer term pain here rather than dealing with this now. I want to address these flight cancellations are not just about Omicron. We have seen holiday travel before get disrupted because of weather. So let's not, lose what's happening here. This is the airline industry, and we're only going to take off if it's safe. But we need to be very exacting about how we're getting people back to work. 5 days may be okay in a breakthrough case where someone is testing negative, and we say that's okay. We're working with the airlines to try to address that.
All right, Sara Nelson, thanks so much for your time on this holiday. We appreciate it.